Studying the relationship between occlusion and muscle function can now be accomplished by combining two technologies: TechScan's T-Scan 3 computerized occlusal analysis system and the BioResearch electromyography system. By integrating occlusal data with muscle activity, you can enhance your diagnostic understanding and achieve optimal treatment results, protecting hard and soft tissue, implants, and restorations. The T-Scan 3 is a simple-to-use device that records and analyzes occlusal forces and timing using ultra-thin sensors. The T-Scan instantly displays interferences, timing relationships, and force levels for evaluation and treatment of occlusion. The BioEMG is specifically designed to record craniofacial muscle activity in both rest and function. The system provides immediate evaluation of the synergy, symmetry, and timing of craniofacial muscle firing to expedite the process of evaluating mandibular muscle function. The two programs synchronize and integrate occlusal data with muscle activity, allowing for dynamic playback. Together, they give a complete view of your patient's bite. Only with this software can you get unparalleled evidence of the effect occlusal contact arrangements has on muscle function. With this technology, you can improve muscle function with occlusal time balancing and occlusal time reduction. Using the two programs together allows you the precision to improve muscle function during closure by improving the degree of bilateral simultaneity. The faster a patient can get into their occlusion, the more quickly they engage their muscle function. Functional movements can also be measured, allowing you to lessen muscle hyperactivity and excursive functions by employing disclusion time reduction therapy. Reducing the disclusion time is an occlusal adjustment procedure that is very different from equilibrating. The goal of the procedure is to shorten the time it takes for the patient to disclude in a measurable time frame of less than 0.4 of a second. In the next few slides, you will see an example of long disclusion time and the effect it has on muscle activity. This patient is Class 1 post-orthodontic and suffers myofascial pain dysfunction syndrome. We will also do a post-operative comparison to see how the patient improved after the clinical adjustments. The pre-op treatment T-scan data shows that the excursion begins. As the patient begins their excursive movement left, we see that both the working side left and the non-working side right are in contact. As the patient continues their excursion, the group function is persisting. See the center of force moving posterior left, while the posterior left and posterior right both maintain contact. Once the patient has reached anterior guidance, you can see that tooth number 11 is in contact. However, there is still posterior teeth active on the working side and contact on tooth number 2 on the non-working side. As the non-working side finally discludes, there is still active contact on the working side. It takes the patient 2.532 seconds into the excursion to reach true anterior guidance. After reducing the disclusion time, the T-scan data shows the patient occluding, and the bite has been balanced to nearly 50% right to left. It takes the patient less than 0.3 of a second to reach anterior guidance after the excursion begins. A comparison of the pre-op to the post-op condition with long disclusion time preoperatively versus short disclusion time postoperatively, you can see the dramatic difference between the time it took to go from the commencement of the excursive movement, number 3, to anterior guidance, number 4. The muscle shut down almost immediately after reducing the disclusion time with occlusal adjustment. This clinical example shows what result the treatment has on hyperactive muscles during excursive function. The T-Scan 3 system synchronizes with the BioEMG system. The two programs together integrate occlusal data with muscle function, allowing for dynamic playback. Improvements in today's technology allow for a more comprehensive and informative diagnostic process. Measuring occlusion time and muscle function together can help you improve treatment planning and achieve optimal clinical results through precision-guided occlusal adjustment. Thank you for taking the time to view this presentation of the T-Scan 3 EMG synchronization module. For more information or research-related articles about either of these products or both of them together, please visit our website at www.techscan.com or contact us at 800-248-3669.